Okay, so I'm going to be doing flexion, extension, and then hyperextension of the neck. Okay, let me do one more time. Okay, flexion, extension, and then hyperextension. Okay, neutral position. I'm going to be doing lateral flexion of the neck. Okay, side. Okay, left side flexion, and then right side flexion. Neutral, neck, left side flexion, and then neck, right side flexion. Okay, I'm going to be doing rotation towards the left first. Rotation towards the left. Neutral, rotation towards the right. Neutral, one more time. Rotation towards the left side, and then neutral, and then towards the right side. Yes? Okay. So we're gonna go with shoulder flexion. Okay. Okay. Shoulder flexion, extension. So when I put this all the way, it's called your hyperextension. Okay. Let me do it one more time. Neutral position. When I say perform shoulder flexion, your starting position should be here. Okay? Because I'm going to be moving that towards shoulder flexion and then extension. Okay? So the counting would be 1. No, you cannot count 2 and then that's 2. Okay? So this is your shoulder flexion. So when I say perform shoulder extension, your starting position should be on shoulder flexion. So the counting would be 1, and then 2, and then 3. Okay? I'm not going to be asking you to perform shoulder hyperextension. The next movement will be shoulder abduction. Okay? Okay, shoulder abduction is okay, so the urinary position is like this. Okay? Abduction, 1. Okay? So when you say shoulder abduction, it's a movement away from the body. So when I do this movement, it's called your shoulder abduction. Okay, we have your abduction or your abduction, and then your adduction or your abduction. Alright, so when I ask you to perform shoulder abduction, the counting should be here. Okay, 1, down, 2, and then 3. Okay? So when I ask you to perform shoulder abduction, the starting position should be here, and then lower it down, the counting would be 1, and then 2, okay, and then 3. It's on the side. Okay, next is we have your shoulder external and internal rotation. So when you say external rotation, okay, not too much, because there's a bone here, okay, and then internal rotation. External rotation, and then internal rotation. So let me do that one more time. So when I ask you to perform external rotation, your starting position should be like this. Okay, and then bring it up. 1, and then 2, and then 3. Okay? So when I ask you to perform internal rotation of the shoulder, the starting position should be from external going to internal. Counting would be 1, okay, and then 2, and then 3, and then 4, and then 5. As you go along with the exercise, you can ask the patient if he feels anything, if she feels any pain, or if she feels giddy. All right? You know, are you okay? Okay, okay. Okay, next is your shoulder flexion and extension. Okay, so when you say shoulder flexion, extension, flexion, and extension, flexion, and extension. When I ask you to perform elbow flexion, then the movement should be 1, 2, 3. So this is your elbow flexion. You can hold this one. Okay, this is to stabilize the joint, the elbow joint. Okay, yeah, to support. Okay. Okay, so when I ask you to perform elbow extension, your starting position should be elbow flexion, and then the counting should be 1, and then 2, and then 3. Okay? Alright? Next is your forearm. This is your forearm. Pronation and supination. Okay, let's say forearm pronation, down. And then supination, supine. Pronation, supination. Okay, when I ask you to perform forearm pronation, prone. 1, and then 2, and then 3. When I ask you to perform supination, your starting position should be like this, and then bring it up. 1, and then 2, and then 3, and then 4, and then 5. Okay, next is your wrist flexion and extension. Okay, one is wrist flexion, extension, hyperextension. Okay, one more time. Flexion, extension, hyperextension. Okay, so we're not going to do all these things here. I'm not going to be giving you this in your exam, on your final exam. But I'm just going to tell you what are some of the movements still that you can actually perform for the patient, especially if the patient suffers from stroke. Okay, you can do finger flexion and extension. Because normally, oftentimes, the patient either have this contracture or this type of deformity. Thank you. And then you can always do extension. So if the patient have prone or have more dominant deformity like this, then you can always perform finger extension. Alright? And then if you see the patient is like this, and then you can also perform finger, because sometimes the stroke patient either have the flexion of the finger or either have hyperextension. So you just have to counteract the movement. Okay, compensate the movement. So this finger extension and then flexion. Finger flexion, extension. Oftentimes, this thumb here is actually like this. For a stroke patient, you can either do thumb abduction, abduction, and then abduction. Okay, these are simple movements. You might think that simple movements, but these are very important, especially if you're teaching the patient on how to do independent in ADLs. This includes your feeding. Okay, if you're going to train your patient to independently eat his meal or her meal, then these fingers are very important. So you can always do thumb abduction away from the body part, and then abduction close. Right? So we have also your thumb flexion and extension. Okay? Next is we have your opposition, finger opposition. Okay? These are your finger opposition. Okay? So these are very important because, for example, if the patient is picking up on something, or maybe trying to shower by themselves, right? Or maybe opening the doorknob or picking up something. Your finger precision. These are your fine motor movements. This is very important. Okay? So those were all the movements for the upper body. We're gonna go with the lower body. Okay? Sister, can you stand up? Can you face that? So what I'm going to do